going to jump into our next topic, which is HPV. Very hot in the media right now. I'm sure that you've all heard about it, and I'm very excited that we have Jennifer here to talk about HPV as well as the other women, because I feel that, again, with this foundation of understanding the immune system of your genitalia, I think you're going to have a little bit of a different relationship to HPV and know when you can relax and when you need to act. And so let's start with just what is HPV and why do so many people have it? Do you want to speak to that, Jennifer?
Sure. So HPV stands for human papillomavirus, and it is so ubiquitous. It's absolutely everywhere. So pretty much guaranteed, if you've had a sexual partner in your lifetime, you've been exposed. All of us have. And that's why if there's any stigma out there, oh, my child would never, like, it's ridiculous. If you're going to be sexually active, you're going to see HPV. Almost everybody gets it, lives with it for a little while, and clears it. Almost everybody. Within about 2 years. So 6 months, 2 years. Things like not smoking, having a healthy immune system, eating a diet full of beautiful, rich, very colorful plants, all of those things are associated with clearing it. Being immunocompromised, like having HIV/AIDS, those kinds of things are associated with not clearing it, smoking. So, it's just one of those things, we're going to be exposed, we're most likely going to let go of it, and there are many different strains of the virus. We call them low-risk and high-risk strains. Low-risk strains are the ones that cause warts. Warts are not considered cancerous or precancerous, totally different strains. Warts are basically just annoying or, like cosmetically a problem. They're not really dangerous. They can, in some cases, get really, like, bothersome and, like, obstructive. But other than that, they're just warts. And they usually go away. Exactly. They usually go away. And I'll get you in a second. And then there's some high-risk strains that can lead to cancers, and not just cervical cancer, which we hear about, but, all of the head and neck cancers, penile cancers, anal cancers, can be HPV related, vulvar, vaginal, as well as cervical. So those high-risk strains, if they get incorporated into the DNA of the cells and live there long enough, can, over years and years and years and years, lead to changes in the cells. They can lead to cancer. But the good news about this is that it tends to be a very, very slow progression, with at least what we think about a 10-year window of pre-cancerous kind of state. So, a visit to the, you can find these and cure or reverse them quite easily.
Mm-hmm. And so what are if someone has these precancerous cells, and Michelle, I'd like you to speak to this as well, because I know there's a sort of a less invasive procedure I think that you do, but so if you find that you have precancerous cells on your cervix, it's sort of not like, oh my gosh, it's the end of the world. There are treatments for it. I mean, it can get more invasive, but talk to me about what those look like.
Do the standard ones first.
Start with the standard, yeah.
Sure. So, of the cervix specifically?
Yeah, and especially what you're doing now in Africa and different, compared with sort of what we might have as given to us as an option in our
right. So because HPV is so ubiquitous, it was a leading cause of cancer death for women in America before the introduction of the pap smears back in the 40s. So many of our grandmothers, great-grandmothers actually had cervical cancer. And it's much less likely now because, we have this system of pap smears. Now we have the high-risk HPV DNA testing, which is really helpful because if you don't have, the high-risk strain, you're not going to have cervical cancer. We can space out screening, so, people do not need to go for yearly pap smears anymore. So, yeah, if we find it, It may lead to another test called a colposcopy, which is nothing scary. It's just like a magnifying glass looking at the cervix with literally vinegar, which is acetic acid, white vinegar. Maybe a little sampling of the cells, again, not particularly painful or scary procedures, you know. And then if we find pre-invasive cancers, you know, you can do a number of things. You can observe, you can immune boost, you can, you know, I can send to Michelle, and she could really, you know, look holistically at what's happening in the body that's leading to an immune system that's not as robust as it could be. Very, very rarely will it progress to cancer in America. I mean, unless you're infected with HIV or, you know. But globally, where women never have any screening ever, it's a huge problem.
So with types 16 and 18, Michelle, do you want to talk about, so if someone does find out that they have one of those high risk types and that they can't necessarily trust that the body's going to resolve it in the 2 to 3 years, what are their options?
Well, as Jen mentioned, and I'm sure everyone's getting by now, one of the major options is to do all those great things we talked about in terms of boosting one's immune system. And usually I'll do a big, you know, sort of history with someone to figure out what pieces are missing from their immune system, what might be missing to help their immune system do better at clearing that virus. And then there are things that we can do, like, again, as Jen was mentioning in terms of the multicolored veggies, the greens, the oranges, the reds. We can enhance some of those things by having people take more of, for example, certain kinds of folic acid and green tea. There's some great studies on some different antioxidants that can really help. And then sometimes, if we need to, we'll go a little bit more direct. Sometimes I'll have folks do an herbal and vitamin suppository protocol where they'll put those same things, green tea, vitamin A, like right up against the cervix and help those cells to really what's called differentiate properly. Like they as they grow, they turn into the cells they're supposed to be, and continue to boost that immune system's ability right there. And sometimes I'll do something that is called an escharotic treatment, which is something that I know people say, well, then you should do it. I just have a study on this because everyone I ever talk to talks about how amazingly effective it is. I kind of liken it to a facial for the cervix. You just kind of, and the reason that works, besides just like, I literally paint things onto the cervix, like sort of a vinegar version, a zinc substance, and a couple of herbs that have this traditional usage that have been also applied for this for a long time now. The point of all that is that I'll share a little case study, which is that I had now 3 different people come to me who had cervical CIN2 or 3, which that just means that it's pretty more advanced, that the changes that the cells have made have starting to look more like moving more towards cancer. It's still pre-cancer, but and they had it what's called up in the canal, which is the cervix is kind of a tube that leads to the opening of the uterus, and so when we're taking samples, sometimes we just get on the surface, but then you can also see up inside the little tube itself. And I had to say, you know, what I'm doing, I mean, all this great immune stuff is going to be really helpful, but I can't actually apply the escharotic like way up in the canal. I think it makes more sense for you to possibly do something a little bit more invasive. We haven't said the word yet, but like LEAP or something where you actually cut out a little bit of it. And in all 3 of these cases, they were like, I'm not doing that. That's just not what I'm going to do. And so, partially because, especially with way up in the canal type, there is a small risk of some fertility-related issues. It's small, but it exists. And so, for folks who are wanting to have children and don't want to have any risk, they said, no, I want to do this thing. And so we did the escharotic treatment, and in all of those cases, every time I get one back in those cases, I'm like, it cleared, like we didn't, and they're still cleared years out. And so there are lots of things we can do that are, I think the reason I share that case study is because I think a lot of times those things have to do with some of the bigger pictures we talked about. One of the reasons we think escharotic treatments or things like that work, or even just doing a colposcopy with a little biopsy, why sometimes that might even clear larger areas than just what the biopsy was taken, is because it kind of irritates the body a little bit, and it wasn't totally paying attention to what was going on there. It's like, oh, there's something messed up down there. all right, I need to fix that. And it's sort of because you see a lot more white blood cell activity after something like that. Just like when you get a facial, it gets kind of red and irritated for a minute, that's blood in the area. So you bring more blood in, the immune cells are like, oh, okay, let's clean this up, guys. So I think some of those things are just about stimulating the body to do what it wants to do anyway, which is move back to a homeostasis, move back to a place of healing.
So this makes me think that I love this, that you can get a facial for your cervix. I feel like this would have taken off in LA if anywhere. So I have two questions. Sort of who would benefit from that? Is it only with abnormal cells, or is that sort of something you?
Something that sort of the full-on escrotic, yes, that would be an abnormal cell sort of situation. You wouldn't necessarily do that preventatively, or even I would say just with HPV and no known cellular changes yet. But all those other things, I mean, those are things that everybody can do. All those great immune boosting things for sure.
So, and the other thought I have is you talk about the healing effects of just sort of stimulating and irritating an area, that it brings blood flow to the area. So wouldn't penetrative sex also have that effect on the cervix?
There's never been a study one way or the other that I know of, but certainly that makes sense to me. Yeah.
Okay.
And also one other thing, because we haven't talked about contraception at all, but the IUD string is thought to be a little bit of an irritant right there at the canal, and women with IUDs have lower rates of cervical problems. So that's
Interesting. Do we have a question? Yeah.
How do you guys feel about Gardasil?
How do you feel about Gardasil? What?
Wait, can you repeat that? Gardasil.
How do you feel about
Gardasil?
What
is that?
So Gardasil is the HPV vaccine that Merck produces. So Glaxo also produces one called Cervarix. Gardasil is just a brand name. So there are these vaccines that we can give before the exposure to the virus. So you want to definitely target it towards, younger, before any oral, anal, vaginal contact is made. That will really reduce your risk of getting one of these high-risk strains. Gardasil actually covers the lower strains too. And it's recommended by the CDC for boys and girls. Girls from the ages of 9 to 26, and boys it's like 9 to 23 or something. I'm supportive. I'm in favor of vaccination for cervical cancer and for the HPV vaccine. And whether it's the bias that I've seen people who are really like vegan massage therapists who are in love with their partner, who have had great lives, so I've seen people who do a lot to take care of themselves progress, and it's a disease that can actually be really serious and globally has massive health costs and outcomes. So vaccination, I believe, could save a lot of lives, and not everybody has access to screening, as I'm experiencing, and so that's my
Thank you. Michelle, do you want to speak to that? Because I know you offer a vaccine workshop as a midwife for parents wanting to vaccinate.
Yeah, I mean, it's as far as that particular vaccine, I don't have as much to say about it, because I think that especially I do, it's a longer topic, I spend 2 hours talking about this typically, but the cases when it comes to Gardasil and its related vaccines, the benefit of the larger world, especially where there aren't regular screenings, I think is without question, and I certainly think that that's a very good use of a tool. So I think for the moment I'm just going to leave it at that.
Okay. I know it's a very controversial topic, and I actually want to use that, and I'll take some more questions at the end, but I want to use that to lead into the new 2012 guidelines for Pap smears, and I wonder who wants to speak to that, sort of what they found in studying, basically testing women and finding that a lot of young women were getting unnecessary invasive procedures that you mentioned could lead to infertility, because of course our cervix holds our babies in and lets them out. So, and if we're likely to clear the virus in 2 to 3 years, what is the new guideline, basically? How often do we need to sort of get our cervix checked out?
Yeah.
Do we want to take questions?
At the end, yes.
Sorry.
Sorry, okay.
Okay, so, no woman should have a pap smear before the age of 21. You know, that's pretty clear. We do more harm than good when we screen young girls and women. So at the age of 21, if you're sexually active, you consider having a pap smear. Women between the ages of 21 and really 29 should not be what's called co-tested for the HPV virus. Because,
What does that mean?
where you do a pap smear, which is looking at the cells, and you look for the high-risk HPV virus at the same time, co-testing. And the reason for that is you're going to find it in everyone, as I said. If you test everyone, you'll find it in everyone. And you'll just cause all this anxiety and stress and relationship issues and all this. And there's no point because the body is very likely going to clear it. So starting at age, and you can space out your screening. So the years of starting when you're sexually active and going every single year for a pap smear, over. And we know now, yeah, exactly. We still recommend going to see a healthcare provider every year, but that's to talk about everything, wellness, preventative care, contraception, all of this, not for your pap smear.
How often would you recommend?
Oh yeah, thank you. So instead of every year, you can go every 3 years between the ages of 21 and 29, and that should be fine. Of course, if you've had a problem, then you go back and you follow up as recommended. But for just average healthy women, every 3 years between 21 and 29 is more than adequate.
And what do you recommend for under 21 and over 29?
So nothing under 21, no screening at all of the cervix.
Mhm.
And another reason is for what you said about we now have outcome data looking at preterm birth and delivery and second trimester pregnancy loss and all that for women who have had LEEP procedures and cones of the cervix, so portions of their cervix actually cut off. And if you're starting at a very young age and finding HPV before your body's had a chance to clear it, your risk of being exposed to one of these procedures goes up. And so we're having, first-time moms who've had 2 previous LEEPs because they were sexually active at 17, and so anyway, that is not helpful.
Over 29.
Over 29, so at 30, I think that the co-testing, so you look at the cells and the high-risk HPV, is really beneficial because if you have HPV by 30, unless you're a 30-year-old virgin, right, which there are, a lot of them, yeah, you likely have been exposed for years already to HPV. So if you still have it at 30, chances are that's a viral strain that your body has not been able to clear. So it's been sitting there for a while. And those are the ones that matter, really. Those are the ones that we care about. So if we find it then those are the women that we just want to watch a little more closely. Not saying that if you haven't cleared it by 30, you can never clear it.
Right.
I can send them to Michelle.
Or they may put it on their own, it's just the risk is higher, and so we just watch it more.
I have a question. I had HPV when I was 26 and a cone biopsy. I went every 6 months and then every year.
Yeah.
And in those 30 some odd years, never had another recurrence. My question is do we build an immunity to HPV? And, is that why I never got it again? Because I've had a lot of sex.
Yeah, yay. That's wonderful. So, you totally, it's just like, a cold strain or whatever. You see the virus, your body recognizes it, clears it, and you cannot get reinfected with that same viral strain. You
Does
can
it help
pick up
with
a
other strains?
different-
Does it help though? Because it kind of recognizes
Yes,
it?
so there's probably some cross-reactivity in the immune response. We think even with the vaccine too. So
Right. That's, if the way the immune system recognizes things is by the little stuff on the outside of them for the most part, the little proteins and things that stick out. So if they're similar, the likelihood is greater that the immune system is still going to be able to have some effect against them. Yeah.
It's my understanding that if you get HPV when you're older, it's harder to clear. Is that true?
Immune system in general tends to be a little bit less robust as you age. It's why, older populations are more prone to like pneumonia and things like that, So yeah, the immune response is less vigorous, doesn't mean that it can't be helped or stimulated.
Well, what about men? Because we've been talking about women. What do men need to do? Do they need to be tested for HPV? Do we all need to have our throats checked? What's the story there? I mean, we're all very focused on the women and their vaginas, but what about the men and other body
Yeah,
parts?
so HPV, and again, like I want to keep this positive and, emphasize that I think sex is wonderful and healthy and supportive of so many systems in the body on so many levels. But yeah, HPV is, a leading cause of head and neck cancer in men. We don't have any general recommendations for men to get screened or tested. There are clinics that offer anal pap smears for men who have sex with men or women that have been having anal exposure. So those things exist, but they're really not standard, and there's no broad recommendations for them.
Part of that is just because they're it changes when new studies come out, but at the moment what studies there are don't show that the benefits of routine screening in those populations it outweighs the stress and the extra biopsies and all those kinds of things, and that may change, but yeah, at this moment I think that the only routine screening for anal pap smears is for HIV positive men who have sex with men. They are recommended to get routine screens, but otherwise nobody else yet.
But if you do notice like a lesion,
Of course.
yeah, and
Yes, so I'm going to just touch on a few things related to that as well. We're actually going to talk about oral sex before we're done today, and we're sort of going to lead in that direction. But a few things that I find interesting are that about 7 out of 10 patients with oral cancer are heavy drinkers. I even saw, because I use the CDC site and PubMed and reputable sites, there was even one that was studying, and they weren't conclusive, but that someone brought up mouthwash, and they were saying the mouthwash that has alcohol is actually can be contributing to throwing off the balance of the throat. I found that interesting. Most people with HPV infections of the mouth and throat have no symptoms. Only a very small percentage develop cancer there. The oral HPV infection is more common in men than women. What else did I want to share? And again, smoking is a big thing, as we've talked about today. So there's a lot to say on that. I think we'll go into some more of it with this topic of oral sex. But again, what I want to bring it back to is that, again, in 2012, we changed the guidelines because we see that our bodies, in most cases, they resolve these things when we have a healthy immune system, which comes from lifestyle and happiness and touch and all these things that we do to really take care of our bodies. So my last question is so if you know that you have type 16 or 18, besides following up with your healthcare practitioner to make sure your body does resolve it, is there a conversation you need to have with your future sexual partners? And what's your thought on that?
I think that yes, you do need to have a conversation with your future sexual partners, and we always put a lot of emphasis on that. You need to reveal your status, and you need to talk to your partners, but we never put emphasis on hearing the other side of that conversation. Mm-hmm. And unfortunately what happens is somebody is brave enough, okay, I have the guts, I'm going to go talk to my partner and I'm going to reveal the status, but the person hearing is just like, what? And then they kind of freak out or cut everything off or whatever. And we need to teach both sides of that. We need to teach both sides of the conversation. We need to teach that it's really important to hold that space that somebody is trusting you with, and to really hear them out and not just jump to conclusions and not just take everything that you learned in your 9th grade sex education class that was you're all going to die if you have sex, and actually do some research on it, on what it is, and see what the probability of transmission is, see if there even is a probability of transmission anymore, see what how you guys can still play safely and enjoy each other's company, etc., and have fun, because sex is supposed to be fun. It's how we all got here. I mean, human life is sexually transmitted. So
It's
take the fear away from it and have some fun. And so if somebody approaches you and says, this is what I have going on or what I had going on, well, let's check it out together and see what's up.
And normalizing it by
Exactly.
emphasizing that everybody's probably been exposed already. And so, and unfortunately, because we're only testing women are the only ones that are then revealing their
Right.
status, right? So it seems to always be like the woman.
And you said something earlier that was really clever and really good to say, is that if we started treating it more like a cold, like this is something that everybody's gonna come up against at some point, and started treating it like, and it is treatable, because the truth is that everybody could be exposed at some point. Most people are gonna be fine, some people aren't. But of the STIs that people do get, most of those have a cure or a treatment or something that can be handled, so most people are going to be just fine. And we're so stuck on, we're still stuck in the 80s that you're going to die from sex, or if you have syphilis, your babies are going to be born with pus coming out their eyes, and all these horrible things that we teach our kids, and then we wonder why they get STIs in the first place, because they're afraid to even carry around a condom because that shows that you want sex. And we're so fear-based that we actually create more problems than taking care of them. And you've been raising your hand for a really long
So
time.
just one second, it was asked, and I don't think it was directly answered, just so to clarify for everyone. My understanding is that currently there is no testing process for HPV for males. You can screen for cancer for areas of the body that are commonly affected, but there's no testing process. So just to clarify that, because it was a question that was asked.
Thank you. Yeah, we can become very female-focused up here. I know next panel will be maybe more diverse. Yeah, and so the last thing I want to end with HPV is that just a little tidbit I pulled off, again, one of these sites. It says, cancers of the head and neck are mostly caused by tobacco and alcohol, but recent studies show that about 70% of cancers there may be linked to HPV. So many of these may be caused by a combination of tobacco, alcohol, and HPV. So you see, again, it's never just a single thing, like, I had sex and now, my life is over. There's a combination of factors, and someone that's using tobacco and alcohol has different emotional factors that are going on. And so, and again, what Laurie talked about, do you even feel comfortable enough with the fact that you desire sex to carry around condoms with you? I mean, how many people, if you got the gift bags today, you're walking out of here with condoms, but how many of us feel comfortable enough to do that? So I want to end with we've talked about some of the treatments, but what, again, can you sort of say why don't we need to have fear about it, at this day and age? Why can we feel really comfortable with, okay, I might get some HPV having sexual experiences because a condom isn't going to protect me from everything, but why can I sort of relax, trust my body? What kind of relationship with a healthcare provider do I need to have to feel comfortable?
Yeah, so I mean, the reason that we've almost eliminated, deaths from cervical cancer in America is because, well, number one, when you get exposed, not if you get, when you get exposed, your body's most likely, like almost always gonna clear it. If it doesn't, as long as you hit one of those screening stations in a 10-year window, like, you're gonna be fine. And then if it's detected at then, we have so many options for how to treat it that are safe, like minimally invasive, easy enough that we can almost always, get it before it becomes life-threatening. So just, yeah.
And we
And,
don't tell
the
our
stress
kids
of
this.
worrying about
Just what I was
it.
gonna say.
The stress of worrying about it is going to suppress your immune system and,
And if that stress keeps you from having fabulous sex that lowers your stress response,
Yeah.
now you've done yourself another disservice. So,
Because we don't tell our kids anything that you just said.
Yeah.
We just tell them, like, if you have sex, you're gonna get HPV and you're gonna get warts and they look like cauliflower growing all the way down your legs and and you're gonna get cancer, all these horrible things, but we don't give them the truth. So that would take care of a lot of stress and boost your immune system just there.
Cool. One last question, then we take a break.
I actually wanted to elaborate on that. I was just cleaning out my closet recently, and I actually found my folder from when I had sex ed in high school. And I thought, oh, let's check this out. Let's see. Yeah, come to think of it, I didn't really learn that much that I remember. So I looked at it, and there was a kind of vaguely drawn chart of the reproductive organs and the parts about them. And then there's some facts about different STDs, and mostly STDs, and then some stats about teen pregnancy, and then it was on to the next subject. It was a scare tactic more than anything else.
It's a big subject, sexual education, and I talk about it in one of my online courses because it's really interesting. You think we've evolved, in our sexual education, but in the parts of our country where we have the highest rate of STIs amongst young people and HIV, we have literally no sexual education. The governments say, oh no, we don't approve of that in the schools, and even our neighbor Canada, they are trying to pass some really great sexual health education, which actually starts when you're young, and people have been protesting saying, you're not talking to my kindergartner about sex, but actually what they're teaching is consent, boundaries, like all of these really beautiful things that lead up to sexual activity. And people, of course, a lot of religious people are really protesting it, but there's still so much that we need to do for sexual education for the young people, because again, if you look at the statistics, that's really the people that are being impacted are the youth. For the most part, like if our immune systems are good, we're doing pretty well, right?
I just
Yeah,
have to
please.
say, I have a 7-year-old,
Okay.
and so, I asked her, what's cervical cancer? She's like, it's when you get a cold on the bottom part of your uterus. They totally get this. They got it.